If you're watching this episode or snapshot live, then you're in your summer semester. You may be taking time to reflect on what worked well the previous semester, what didn't go so well. Or maybe you are currently teaching like me and you're thinking about what is it that you want to try new this summer? Well, all of these are great reflective elements, and we're going to spend time again in this snapshot focusing on Kolb's experiential learning theory. The best teacher that we have in order to prepare to be the best nurse educator in the classroom is experience. Experience really is our best teacher. And it's the same expectation when it comes to the C&E exam. 70 to 80% of the questions are at that application and analysis level. So how is it that you equip yourself effectively to be successful on the C&E exam? Well, our goal here at Dr. Sellars Educate is to provide resources that will give you ease. Now, it doesn't mean it's going to be easy when it comes to preparing for the C&E exam, but we want to create a momentum of ease where you are productive and effectively using the resources that are most likely to help you achieve success on the C&E exam. You did hear music playing in the background. That is a way for us to kind of set the mood for active engagement and redirect the energy in a positive way. I encourage you to use that as a technique in your classroom as well. And we're also going to be using a couple of other resources that we haven't used before, or it's been at least a while since we've used them. So we're going to be using our iPad. If you're familiar with Zoom and you've used it before, then you know there's a great option to attach your iPad to the students' learning experiences that you're going to create for them. All right. And then you can just simply use a stylus. We're going to use a different strategy. We're going to do a pre-assessment or a pre-quiz to figure out what it is that you all have muddy points about. Okay, so hopefully it will be a good experience for you all. And if you're tuning in for the first time, welcome. We're delighted that you're here. Make sure you subscribe to our YouTube channel. That way you'll be notified, and click the bell. That way you'll be notified every single time there's a new snapshot, which happens every week. And if you're listening to us on our podcast, welcome. We're delighted that you're listening to us. We know that lives can get really busy, even during the summer. So we're grateful that you're here, however you're choosing to listen to us. All right, so let's go ahead and start a little bit different than we normally do. All right, so I'm going to share my screen, and I'm going to follow along with you all to draw a circle. Okay, so this is going to allow us to engage and have a clear plan of what your next steps are going to be. Okay, so you should see a blank screen. I am using my iPad right now to draw along with you all. Okay, so use your study worksheet. If you didn't print that out, that's okay. Just use a blank piece of paper. All right, so what we're going to do is go ahead and circle and draw a circle. All right, let me see if I can get my pen to work. So go ahead and draw a circle on your blank sheet of paper. All right, so once you draw your circle, while my pen is turning on for you all, now I want you to actually divide it into 4 sections. Okay, so you're going to put a line from top to bottom. All right, here we go. Mine is now working. So you're going to draw a pie. Okay, like that. Okay, so that's your circle. That is to depict the Kolb's experiential learning theory framework. And then the 4 sections that you've divided it into by drawing your cross creates the 4 learning styles as well as the 4 phases associated with the learning cycle. All right, so what is it that you know already? I only want you to focus on content that we've covered in our snapshot. So last week, we focused on 2 different elements of Kolb's experiential learning cycle. All right, so who can tell me, or just write it down, or if you're live, definitely put it in the chat. So we compared abstract conceptualization, which is all around, you guessed it, thinking. All right, so we compared thinking versus doing, right? So abstract conceptualization was here. And then abstract experimentation is over here. And then what about the learning style that we talked about that lives right here? All right, so if you chose Converger, you are correct. Excellent. And then I want you to write down what are some teaching strategies that we integrate into our classroom to connect with the Converger. All right, so write that down as a pop quiz. Bonus points. In this snapshot, we're going to focus on who the type of learner that's here. And we're going to focus on the type of learning that happens here at the top and then here on the side. Okay, so if you guessed reflective observation, which is all about watching, you are correct, right? And then at the very top, we know this is all around feeling, right? Excellent. And this is our concrete experience, right? So this is CE versus RO. And what type of learner lives here? If you chose Diverger, you are correct. Excellent. Give yourselves a round of applause. If your diagram looks anything like mine, or it may look even prettier. All right, so excellent. I encourage you to use this activity every single time you're showing up for this snapshot, especially if this is a muddy point for you, because we know 70 to 80% of those questions are going to be at that application and analysis level. It's important that you physically write it down. Now, I know many of you like to take notes by typing. I'm the exact same way. However, we know that we can, depending on the research, we're 70% more likely to 80% more likely to retain the information when we physically write it down. Okay, and just to recap, what I'm using right now is a virtual whiteboard, essentially. Now, Zoom has a whiteboard feature, but I don't like it as much. So that's why I chose to use my iPad. And so what I did was I opened up a note and I have created that for you all, and it allowed me to draw as if I'm using a whiteboard. All right, so I encourage you to use different technologies, and it doesn't have to be perfect. You can share with your students that you're trying something new. I think it's just impressive to students when we try new things. It really shows our vulnerableness, and then it also engages us as a teacher or facilitator of knowledge to engage in a learning process differently, right? It kind of takes us out of our comfort zone. And just like with teaching, the more experience we get with engaging our learners using different technologies, the more comfortable we're going to feel and the more confident we're going to be. All right, so for your resources, Billings and Halstead is our, what we call our Bible in nursing education. So page 30 is where you're going to find content about Kolb. And then page 35 in Dr. Caputi's CNE review book gives you, and that's going to be table 2.3, gives you great information and teaching strategies associated with Kolb's experiential learning theory. And then if you have our study workbook, it's going to be on page 27. This is where you're going to see all of these resources that will help you stay focused as it relates to the content that we are covering in our snapshots. And then finally, and most importantly, it goes back to our study worksheet. Now, why is it that we talk about our study worksheet in every snapshot? It's because we want you to have a clear path to success. 90% of the retention that we gain is rooted in our ability to teach it and to demonstrate it. Okay, so in order for you to really hardwire these teaching practices that we're talking about in a way that's going to help you remember them when you get to the exam, it requires you to really use your application and analysis elements that we're going to be talking about in this snapshot, just like we do in every snapshot. So again, pull out that study worksheet in addition to the resources that we've already talked about. And we call it step number 1 because this is going to allow you to write down the note. So if you're not familiar, if this is your first time joining us, welcome. We're delighted that you're here. And if you're returning, we're excited that you're here as well. But if you've been here before, then you know the resources we talk about. But if you're new to us, then maybe you weren't familiar with the resources. And we don't want you using any other resources. These are the only resources that you will need based on the data that we have collected from colleagues over the past several years. Okay, so even if you have others, we don't want you to use those. We only want you to use Billings and Halstead and Dr. Caputi as your textbooks. And then the other resource that you're going to use is the candidate handbook. So if you're on the journey for CNE, CNE novice, or CNE clinical, NLN has a specific handbook that describes exactly what you should expect and how to best prepare for your exam. And that's going to be at nln.org. I just want to share that we are continuing to celebrate Pat She just passed her CNE exam, and this is what she sent to us via email. As soon as she exited the exam, she said, I passed the CNE exam. Thank you so much for your encouragement and teaching to help me pass. You are the best. I want to point out that she talks about encouragement and teaching to help her pass. Now, Pat did that hard work, but certainly what we want you to focus on is maximizing the resources you have to decrease and eliminate really wasted time. We help you follow a productive process that is efficient in maximizing the time that you have so that you can study the right content using these 2 textbooks, and that we map all of our content in our review and our snapshots. Any curriculum that we develop, we align it with the competencies. Okay, so if you are struggling with understanding Kolb's experiential learning theory, you're not alone. More than 60% of colleagues are in the same situation as you, and this is why we're taking a process throughout the summer and looking at key content, hopefully to help it stick for you as you think about what your muddy points are. So CE again versus RO is what we're talking about. Feeling versus watching. Just want to share this model again. Hopefully yours looks similar to this or similar to mine, maybe neater than mine was earlier. But we're talking about the concrete experience, and that is associated with feeling, versus the reflective observation, which is associated with watching. And we know there's value in both, and we're going to explore what are those teaching strategies that you should incorporate to tap into all of our students' learning styles, but specifically in this snapshot, we're just focusing on the two different phases of learning, and then we're focusing on the specific diverger learning style that prefers to feel and watch. But we know they can't stay there, right? We help them move through this learning process, this learning cycle as described by the Kolb framework. Let's take a look at our thought-provoking question. So a nurse educator is designing a simulation-based learning activity for her students. She wants to ensure that the activity aligns with Kolb's learning cycle to enhance the learning experience. To fully engage students in the active experimentation stage, the educator should A, require students to write a reflective journal entry about their experience, B, have students participate in a debriefing session to discuss the simulation outcomes, or C, ask students to apply the concepts learned in the simulation to a new and different clinical scenario. So with our thought-provoking question, we always want to consider 2 thoughts. Number 1, and when you sit for the CNE as well, but number 1 is, what is this question actually asking me? Okay. And then second of all, what is it that I know for sure about content related to this question? All right, so let me enlarge it a little bit so you can now kind of think through those steps. What is this question asking me, and what is it that I know for sure? All right, and then for the CNE exam, you may have 3 options, you may have 4. We just want you to focus on the content using the blueprint that you have in your candidate handbook to ensure you close your knowledge gaps. Our goal is to be able to enhance the learning experience with our students as we support them to move through all 4 of the phases in the Kolb's experiential learning framework. Well, how do we do that? Well, first, it starts with us having a good understanding of how to effectively teach students, how to effectively facilitate the learning process so that the students are continuing to move through, especially if they get stuck, right? If they get stuck between the abstract conceptualization phase and the active experimentation stage, then they can feel pretty overwhelmed. Okay, so we don't want them to get stuck. We want them to keep moving through the phases so that learning can actually happen. So when we think about how we move them through the phases, it's important for us to know 3 things primarily. Okay, so write these down. Number 1, you want to know the definition of each of the phase of the learning cycles, okay? And then number 2, you want to know what is that learning style associated with each of those phases, okay? We looked at diverger, we looked at converger, okay, as 2 examples. We'll continue to move through over the next several snapshots. And then number 3, what are those teaching strategies that will help connect the student with the content associated with that phase of the learning cycle and associated with that student's learning style? We all learn differently, and we have to be able to tap into students' learning styles, maybe that they're most comfortable with. And we also have to support them in adapting to learning styles that maybe are not their primary learning style preference, right? They still have to be able to engage in all of the different learning styles. And so we're able to do that by meeting the students where they are, mapping the teaching strategies to our learning objectives, and being able to offer a variety of teaching strategies that will connect with all 4 different types of learning styles in the classroom. All right, so what else is it that you want to consider as we think about how we integrate and apply these teaching strategies that we're exploring? Well, looking at the balance, specifically with concrete versus reflective opportunity, we want students to have time to process the information that they have experienced with that direct hands-on care, as an example, in the clinical setting. So with the concrete phase of the learning process, it can be overwhelming for some students, especially for those students who get stuck in the active experimentation phase, where they're thinking about what didn't work so well the previous time and maybe trying to formulate what their next step should be. So getting them to move to that next concrete experience is important. So what does that require? Much like what we talked about with abstract experimentation, giving students feedback, reassuring them, making sure, first of all, that they're competent before they have an opportunity to practice that skill again. So maybe we invite them into the skills lab during open lab time. We reinforce, we remediate to ensure that students have clarified any muddy points that they have. We also, especially in the clinical setting, we want to be in the room. If we know that a student struggled with inserting a Foley, let's make sure that they are reassured that we are supporting them to learn the steps that are associated with inserting a Foley, and hopefully they will be successful in the process. We also want to give students time to reflect. Now, journals are a great way, but we also know during post-conference, that time is essential to make sure students have had a chance to really talk through any content or concepts that they're not clear about, or maybe they observe something in the clinical setting that they have questions about. Maybe they're struggling kind of connecting the dots. So let's make sure that we have that dedicated post-conference time with our students to kind of talk through any challenges that they may have. Also, during simulation, we know we debrief. Even during our didactic experience, let's leverage debriefing in our classroom as well. Ticket to Exit is a great way to kind of debrief and to better understand how students have connected the dots, or maybe not so much. And sometimes it's just simply looking at students' body language. That can tell us a lot. So with our didactic experiences, where we are spending maybe 2-3 hours, I heard that from colleagues just this week, going through content, let's make sure we're checking in and that we're not losing our students. Oftentimes, we are laser focused on teaching that content that we have in our lesson plan and our learning plan, so much so that we can leave our students behind. And that's when learning loss happens, because students are not able to grasp these concepts. Scaffolding is lost because students don't really understand those foundational elements of remembering, perhaps, or analyzing. And so students' ability to really engage at that higher level, they're going to struggle, right? When we think about Tanner's clinical judgment model, this is why students are really not able to make decisions based on data that they have, clinical data, in an efficient way. And this is what leads to adverse events with our patients. All right, so what else is it that you want to know when we're talking about the differences between the two? Well, first, with Kolb's experiential learning theory, we know that those concrete experiences do require the actual hands-on, and as much as we possibly can. I know we use quite a bit of simulation in some nursing programs, but as much as we can, engage students in those hands-on experiences, because we want them to interact with the human element, the emotional, we talk about the affective learning domain. That's a really important element. We heavily focus on the cognitive and the psychomotor, which is essential, but let's tap into that affective learning domain as well. Let's leverage those experiences in our clinical settings to ensure that students are able to put all of these puzzle pieces together, because we know that patients and clients' personalities can directly influence care. So let's make sure whenever possible, we're able to engage in that debriefing process to explore that effective learning domain as well. And then, of course, we want to take time to reflect. So giving students a chance to observe, yes, we want that hands-on experience, but we also want students to be able to process the information, to really witness us or our clinical faculty be able to engage in that demonstration of skill. Students taking time really to take an inward look and to make sense of it for themselves, seeing themselves in that specific clinical situation really is what that introspective opportunity allows students to have, along with the observation. And we don't want students to stay stuck there. We know students can become overwhelmed sometimes, especially if they're struggling with that clinical skill in the sim lab or in the skills lab. So we have to spend time reassuring students and facilitating that clinical experience with them whenever they get stuck in this watching phase, right? And then as we're putting these puzzle pieces together, we want to consider what's missing. So if we, as an example, have developed our PEDS curriculum for it to be simulation only because perhaps we struggle with getting a PEDS experience, then how do we validate and really give students a chance to interact from an effective learning domain? We can do that through unfolding case studies. We can do that even through role playing. Specifically with PEDS, I know there are some great sims that have been developed out there. So just looking at the quality of the sim, because I think that's our reality and that's not going to change. So let's leverage the simulation to the best of our ability so that students still have those real life experiences that they're able to leverage in a way where they can make the clinical judgment decisions. And then when we talk about balance, this is integrating the journaling aspect and group discussions for our reflective learners, where they're able to talk through what their experiences were like that day. Recency is so important when our students finish those clinical experiences that may be a struggle for them. Taking some time to debrief. And if we're picking up on those visual cues with our students, especially at the end of conference, then inviting the students to meet with us during office hours, or if we hear from a colleague that was in the clinical setting and we're in the didactic, if we hear from our clinical colleagues that certain students are struggling, just making sure that we're partnering with our lab faculty, our sim faculty, to identify a specific remediation plan or really just a reinforcement plan to make sure that our students are able to move forward with the learning cycle that Kolb talks about. And then last is for us to incorporate those visual experiences that we want to engage in. So role playing is an excellent activity that will help students kind of pull the pieces together. And then group work using technology. We're using several right now in this snapshot. I'm also using Prezi. That's where you see the side-by-side presentation. That's why I really like Prezi, because you can easily flow through the content without it being distracting and cumbersome. So just think about how can you better leverage technology to promote the learning experience, right? We don't want to distract from it. And then, of course, these real world examples and giving constant feedback to our students. Formative feedback is so essential for these students that may get stuck in that reflective observation. It's important for them to move through all of the cycles. So we just want to keep it going, keep those thoughts moving, and keep those direct care experiences also integrated into the curriculum as much as we can. I know sometimes it's out of our control. We saw that during the pandemic. There was nothing we could do about it. But we want to, as much as we can, take advantage of those hands-on experiences when possible. I like this checklist, so I wanted to share this with you. These are just some of the teaching strategies that you would want to identify for your learning experiences. And I encourage you, I know this may seem so simple, but looking at the course that you're teaching and identifying what are these teaching strategies that I'm using and how do they align and map back to Kolb's experiential learning theory. All right, so I thought this was a really nice checklist to kind of put things in perspective. When we think about our progress in integrating reflective and concrete experiences, where are you when you track it? You know, going back to this checklist, I'm going through and checking off these opportunities that you've incorporated in your classroom to do a barometer check to really monitor what is your level of commitment to creating these diverse learning experiences for your students that have so many different learning styles. And we know that depending on the content too, students may struggle. For example, students that are focused on that reflective observation and they really prefer watching. Well, if they did not do well, if they didn't perform well, a certain skill, then they may start to internalize that experience to reflect their ability to be a good nurse. And we know that's not true. So thinking about how can we coach, how can we better facilitate and support using a collaborative approach across the learning experience. So pulling in our didactic faculty, our clinical faculty, our skills sim faculty to really focus on what is going to best support that student's advancement through all 4 phases of Kolb's experiential learning cycle. All right, so now for our last content in our snapshot, if you chose C, asking students to apply the concepts learned in the simulation, you are correct. So give yourself a round of applause if you chose C. And this is what I want you to think about: the rationale for the correct and the incorrect answer. Okay, so let's see how close you got to the rationale for the correct answer. All right, so this is going to be, again, if you want to take a look on page 30 in Billings and Halstead, and then page 35 in Dr. Caputi's C&E review book. So with our thought-provoking question, when we look at the active experimentation phase, we know that this is the actual doing component of the cycle. Students are thinking about their prior experience, they're reflecting on it, and they're thinking about what is it that I need to do differently next time so I can have a better outcome. Going back to that Foley example, students are thinking about what did I learn from that experience and what is it that I want to test out or refine for my next experience. This is a crucial component of students developing these problem-solving skills and their adaptability in clinical practice. All right, so hopefully you chose the correct answer. If you did not, I don't want you to be too hard on yourself. Remember, these are thought-provoking questions, and it's just as important to understand the rationale for the incorrect answer as it is for the correct one. So A says require students to write a reflective journal. Well, we just talked about from a reflective observation. That's a great strategy, but active experimentation is centered around doing, right? Exactly. And then B, debriefing, that again is a great strategy for students to engage in during that reflective observation, but we want students to be actively involved, exactly what it says, in the doing process whenever we are integrating the AE activities or active experimentation. Well, we hope this snapshot has been helpful. Make sure, hopefully, you've reflected on what your objective was for this snapshot, and we hope you've achieved it. If you have any questions, reach out to us, info@drsellarseducate.com, and we look forward to seeing you next week. Have a great one, everybody.